Good afternoon, everyone. My name is Joseph. I'm with the American Business Council. Welcome to the webinar today, the evolving role of the private sector in public health. I will give an overview of the housekeeping rules. Please note that your mics have been muted as you've logged in, and only the panelists can have their video on. You can send in your questions during the Q&A, and when sending your questions, please identify yourself and your organization. If you want to speak, please kindly raise your hand. Relevant materials and resources will be made available to everyone after the webinar. So first, I would like to introduce our welcome note speaker, Ms. Azukaego, the CEO of Africa Resource Center for Excellence in Supply Chain Management. She oversees supply chain transformation projects in Nigeria and has also supported other African countries in strengthening their healthcare systems. Her work has improved financial investments by the federal and state governments. I would like to welcome Azukaego, the CEO of the Africa Resource Center. Over to you, ma'am.
Okay, good afternoon, everyone. Because I'm working from home and the network is not perfect, I crave your indulgence to go off video so that you can hear me clearly. So I hope you don't mind. Okay, so good afternoon, everyone. Thank you for this session. We have been looking forward to it. Like Joseph said, I am Azuka. I am the CEO for Africa Resource Center for Excellence in Supply Chain Management. We call it ARC ESM for short, or ARC, just to simplify it. So ARC has been in existence in Nigeria since 2016. It's actually like a new ideology initiated by the Bill and Melinda Gates Foundation, which is more around how do we have an entity, an independent, unbiased entity in the country to begin to engage governments on their journey to sustainability. The whole idea is that we all know what is happening, the realities of the COVID situation, and also the dwindling financing mechanism put in place by donor agencies. More and more, the world is looking at governments, ministries of health in Africa to invest in the health sector and not be so donor dependent. So the ARC was initiated to support that direction. How do we have an entity that will provide practical steps or practical tools or practical models that governments can adopt on their journey to self-reliance? I'll use that term. So we have been working with both the federal and the state ministries of health in Nigeria to kind of begin to move that needle, a rethinking of our approach. And one of the things we have been doing with government is how can we look at the private sector? How can we have better collaboratives or partnerships with the private sector in a way that we can do business with them to expand the availability of medicines, but also to make sure that the businesses are profitable to the private sector, and also leveraging the private sector CSR as a means to infuse more funds into the health system. That's the corporate social responsibility. So basically, we have been doing this. It has been a journey. It has been challenging, to say the least, but we are beginning to see major changes in the ecosystem. One of which is we are very happy to have this webinar with Yobe State Government. The Executive Secretary, Yobe State Drug Management Agency, is here. He will be talking about the experience with working with private sector and the opportunities that has given the state to meet their health goals, and also how that has really favored the companies that they have been working with. We also have one of the key members of my team, Dr. Stephanie Fowler, who is here, who will also highlight from the private sector angle what their experience has been working with Yobe State, and looking at the angle of what we say from PNG Man, the PPP concept, which is patronize us, pay us, and I'm trying to recall the third P, and I'll recall it and put it on the chat box. Either way, it has been a good journey so far with Yobe State, and we're happy to have whether it's the documentary and also the presentation from the Executive Secretary, Abdulaziz Mohammed, who is here. All in all, we hope that you all enjoy yourself, and we hope to see more. We have been championing local private sector, and we have been engaging ABC as a key partner to say, how do we then look at the global private sector? What is how do we leverage that that component, and also how do we get the states to do business with them? Are there opportunities? So having said that, you are highly welcome, and I hope we have a delightful time together. Thank you very much.
Apologies for that, since we're having technical issues with the audio. So I would like to welcome the moderator, Dr. Stephanie Fowler, who will moderate the session. Over to you, Dr. Stephanie.
Thank you, Joseph. I'll just turn on my video. Good afternoon, everyone, and thank you all for joining the session. Thank you to the American Business Council as well for giving us the platform to be able to engage with their members. Apologies for the issues with the video. What we will do is we will share the link to the entire documentary with the ABC team so that they can forward to the participants after the session. So just moving on to the next part of the agenda, we will have the Executive Secretary of Yobe State Drug and Medical Consumables Management Agency make his presentation, where, like Azuka had highlighted, he'll be speaking on the partnership with the local pharmaceutical companies and their experience so far. Thank you. Joseph, if you can help project the ES's presentation. Thank you.
Okay, thank you very much. Good afternoon, everybody. So, as has been introduced, I'm Abdulaziz Garba Mohammed. I'm the Executive Secretary of the State Drugs and Medical Consumables Management Agency. Here situated in Damaturu, Northeast Nigeria. This is just going to give a context, and we are just going to be discussing the experiences of UDMA in terms of engagement with the private sector. However, the presentation will mostly center on, I think, what we need to do as a government, and then what we expect from the private sector. And then around those, we'll be discussing what we think the experiences are for UDMA in the context of what we are operating. Next slide. So this is just a brief outline of what we are going to be looking at. Next. Now, just as a background, Yobe State was created in 1991 by the administration of General Ibrahim Babangida. And since that time, we have been implementing a drugs revolving fund scheme. And a lot of schemes have been put in place actually to ensure that we have safe and affordable drugs and medical consumables that are accessible and affordable and available at all times to our clients. However, this has not met the expectations of the government of the state. And some of these schemes that we have implemented previously include the PTF DRF. We all remember the PTF DRF. And then we had the hospital-based DRF schemes. This is where the hospital on their own would source drugs and then sell to patients and then revolve the funds. This also has not met with much success. Then we have the free MNCH. This has been working in the state for about 13 years now, and also challenges with that because it is a free product of the government, and this in terms of funding has had its challenges. And this also included under fire and accident victims. Then we had the sustainable drug supply system. And when we talk sustainable, we thought that it was going to last till eternity. However, there were flaws in the implementation of this SDSS, and we have not seen the requisite impact on the system. Then we had the NSHIP, which came with the performance-based financing, and that is where hospitals are rated based on certain criteria, and then a kind of financial, benefits were given to those facilities that have met certain criteria. This also was not sustainable in that funding is not, limitless, and so it was a World Bank project, and it has come to a close. So now facilities have to look for other sources of funding for their DRF schemes, and that is how we looked at it and said, okay, we need something that's more sustainable. Now, as we know, also there is a lot of faking and counterfeiting and identification of products in the country, and this has actually posed a great threat to the well-being of the people of the state, and the government feels that something needs to be done about this so that the kind of healthcare that we dream for the people will be actualized. And then also we have donors that bring drugs and other inputs into the state. And we have seen a lot of suboptimal coordination of these activities. And we've had instances where we've had a lot of wastages due to the uncoordinated efforts of these agencies. And so with this, with the benefit of all of these experiences, the government of the day decided to put up an agency that would manage the supply chain for all health commodities in the state. And that is how the Yobe State Drugs and Medical Consumers Management Agency came into being. Now, the law establishing the agency did not actually stop at that. It is actually the Yobe State Drugs, Reagents, Medical Consumables, and Equipment, Medical Equipment Management Agency. But just as a short form, this is how the name comes out in the law. But the provision of the law is very clear about what needs to be done by the agency or the mandate of the agency. Next. Next slide, please. Now, we said that to be able to have this sustainable drug supply system, we needed to have an agency, a standalone agency that would be impose a quasi-commercial venture of the government to see that, to ensure that these commodities are available at the last mile when they are needed at all times. And so a law was promulgated in 2019, December, to establish the agency. And this is the name of the agency, Yobe State Drugs and Medical Consumers Management Agency. And also part of the provision of that law is that the agency that it should be a body corporate. That means it is a corporate entity, so it can sue and be sued, and it has the power also to acquire, hold, and dispose of property. So these are parts of the extant law that establish the agency. Next. Now, what are the functions of the agency? As we know, basically what it does is supply of all drugs, consumables, equipment, everything that is needed in a health facility. And so the functions include selection, quantification, sourcing, procuring, supply, warehousing, sale and distribution of drugs, medicaments and other reagents and medical consumables that satisfy the healthcare needs of the state. And then it is also supposed to engage in the manufacture of quality and affordable drugs and medical reagents and consumables, and then carry into effect all national and state policies of the revolving fund scheme. So we see that even though we are operating at the state and then there's devolution of powers, we are not actually working in isolation. And that is why we try to see that we actually work in tandem with the national government to see that this is a sustainable system in the state. Next. So the powers of the agency, what can we do as an agency within the borders of Yobe State? First, we participate in regulating and coordinating and supervising activities related to drugs and all other reagents and medical consumables, and also donations in the state. So donation, we underlined it because we've had a lot of challenges with donations in the state, and we felt that a lot of wastages are actually happening with the donations. Then initiate, encourage, and participate in any arrangement promoting public-private partnership. And this is where we are holding on to what we are doing with ARC, with the farmer group, with all the partners that we are engaging, because the law actually gives us the power to participate in all of these arrangements. And we are trying to exploit it to the fullest. And that is why, even from the beginning, we started with accessing this kind of partnerships using ARC as our platform. And we are very grateful for ARC for coming to our aid at that material time. I just want to stop here because I think this is where we are going to be focusing most of the discussion. And so the other powers of the agency are outlined, and we can actually access the presentation and some of those. Next. Now, miscellaneous provisions of the law. The first one is subject to the provisions of this law or any enactment, the board may charge fees for any service or facility. So this is also part of the PPP we are looking at. We can actually provide services to other agencies, not just our health facilities, and then we'll be able to enter into relationships that will be mutually beneficial to both the agency and our partners. And then all public health institutions owned by the state are enjoined to patronize the state. This actually gives the agency the leverage, the sole proprietorship of supply of drugs, reagents, and medical consumables across the state. And we think that is a big plus for the agency because then it means we have an exclusive market. And then the products of the agency shall not be subjected to any state tax laws. I think this is also very important because we know multiple taxation in the country is one of the bane of businesses in the country. And so the state ab initio has said that this is not going to happen. The only taxes that we have operable in the state now on drugs and medical consumables is the federal inland revenue tax. Whatever tax is not applicable in the state as far as their state laws are tax laws. And then the board may insure its property and services against risk of all descriptions. Currently, we have insurance cover on all our warehouses and also our goods in transit. So we are actually looking at it as a business model. We are not operating as a government agency per se. And so we think these are attractions to our partners that are coming into partnership with us. Next. Now, what do we expect from the private sector? As a partnership, we are not looking at it just in terms of partnership. Like we used to joke with ARC and all our partners, we say ours is a marriage, and a marriage that we hope will last forever. There's no divorce in our relationship. So every partner that we have is coming into it as an equal partner. And we are looking at it as a partnership like that. So we want to partner with the agency to provide qualitative drugs, reagents, and medical consumables at rock bottom prices, but they have to be qualitative so that we'll be able to resell to the health facilities. Now, the reason why we are looking at it this way is that Yobe is purely an agrarian state. And we don't have the kind of money that other people have, like Abuja and Lagos and Port Harcourt. So even though we are looking for the best quality for our populace, we're also looking at the most affordable of those qualities that we can give to the people. And then also in terms of that, we know that capacity, the skills required to run a supply chain system is what is going to make it sustainable. And so ab initio, we started with saying that all partners that we have will have to support us in terms of building capacity of our staff so that we'll be able to maintain our operations and it is going to be optimal and efficient. And then research collaboration. Also, we need to engage in research because knowledge, I think, is what will drive sustainability. And so for us in Yodma, we are looking at how to make ourselves more efficient. We are looking at how to have sustainable solutions. We are looking at how to have effective solutions that will actually translate to what we have in rural areas, that everybody receives that qualitative healthcare delivery service that we propose in the state. That is based on what our executive governor has already promised the people of the state in his campaign, during his campaign. Next. Now, we have had a lot of experiences, yes, and just looking at it, we have some impact that is there, even though they are just really, we are not looking at how do we put it, figures and data and everything. Some of these things we have some data, but then we are talking about impact. When we are talking about impact, there's something noticeable that we have already started seeing. Yodma started operations just 7 months ago. That was precisely in October last year. And within that space of time, we have seen a noticeable improvement in terms of our stock out rate. When we started, it was about 27% stock out rate. As we are speaking now, 7 months later, it's just about 11%. And we feel that with that, we're actually reaching our target. For us, our stock out rate that we actually think when we started should be around 10%. And it seems that within the first year, we may be able to achieve that. And then we'll see how we are going to sustain that. And then also we've seen that our drugs are much cheaper, in the sense that it has become a problem for us, really. Because sometimes we have people going to the facilities and just getting spurious prescriptions just to get the drugs and resell outside. So these are some of the issues that we have with our products. And that is just basically because we engage in this kind of partnership. And then confidence of the general public in the public health facilities is gradually returning. Because people now go to the facilities and they have not just drugs available, but quality drugs. I think when people go to the facilities and they get drugs and then they realize that they get better when they take these products, then their confidence gradually returns to the facilities, as opposed to what we used to have in the last few years. So I think these are some of the impact of our collaboration with the private sector in the health outcomes of the state. Next. Now, investment case for private sector. I think we all realize that Nigeria is a huge market. With a population of over 200 million, I think we all agree that there's a lot to be done to reach where we want to reach. And for us in Yodma, we are looking at us just as a microcosm of the whole Nigerian nation. And with what we have in the state, not just in terms of provision of drugs and medical consumables, but also in terms of provision of medical, laboratory, and diagnostic equipment. These are areas where we feel that the private sector can come in. We know these things are expensive. We know it will take a long time for government to be able to put these structures in place. So a kind of partnership between the government and the private sector, I think, is what is going to move us to the next level. And for us in Yobe, we have already started doing that. The present administration has already had giant strides in that regard. We have an MRI machine installed in the state now, and I think it is the cheapest in terms of patient cost in the country. I think our MRI, each session is about, a session is about 40,000 naira. I'm not sure there's any where that it is done below that. So for us, these are the kind of things that we are looking at. For example, we have now we have a PCR lab and all of it. So for us, in terms of partnership, in terms of investment, we think these are fertile ground. The whole nation is a fertile ground for us to be able to seize this opportunity to have this PPP arrangement. And then also, as you have seen in our laws, they specifically provide for and encourage PPP, and also the protection of private investment resources. So we think these are really things that would encourage the private sector to be able to partner with government in terms of provision of quality healthcare delivery service to the populace of the country. And then also the convergence of the public and private sector will significantly improve the business environment, notwithstanding what is happening currently. We feel that both the public and private sector would be the better for it if we have that kind of convergence. And I think based on the experiences of Yobe, having a robust legal framework, having the kind of documentation that we have, the MOUs that we've entered, and having those kind of relationships are what really we think will improve the kind of partnership that we're looking at from the private sector and through the public sector. I think confidence building, when we started with ARC and the Farmer Group, there was a lot of skepticism. A lot of things have happened in the past, and the private sector was really very skeptical about that. But I think with what Yobe has done, it has proven that government could live up to its responsibilities. And this is what Yobe is trying to showcase. And we hope that this meeting will also send the right message to ABC to be able to partner with us in terms of what we are trying to achieve. Then involvement of the Nigerian Governors Forum is another positive to the sustainable health commodity supply system that we are trying to put in place, and also as advocated by the National Product Supply Chain Management Program. The Nigerian Governors Forum, I think, is a huge enterprise, and having their backing, I think, is going to a large extent give confidence to the private sector that what we are doing actually is worth doing, and they are going to partner with us in the public sector to be able to give the kind of quality service that Nigerians need. We had a meeting about 3 months ago with the Nigerian Governors Forum Secretariat, and it was a very fruitful meeting. And we hope that with more meetings being held, we are going to be able to see that we provide the enabling environment for people to invest in our various states. Then increasing demand by donors for efficient, effective, and accountable systems. I think this cannot be overemphasized. There is no system that is sustainable if it is not efficient, if it is not effective, but most of all, if it is not accountable. We've had several calls previously that put to question what we are doing, both as government and as a private sector. I remember in 2019 when we started Yodma, and there were issues with Global Fund because some products actually were being buried. And the state was saying that when these products were distributed, the state was not made aware of the distribution. And then Global Fund was saying, but these products came to the state. So nobody could actually pinpoint where the problem was. And the state bluntly refused to take responsibility for what it did not know. And we think that actually was a turning point for us in the state to say, okay, this is what we want to do, but we don't want to have opaque systems running in the state. So we should have a transparent system, we should have an accountable system. And that also formed our vision for YODMA when we started. So that what we have is an open system that everybody will see, and the public and the private sector would have the confidence that yes, this is a transparent society or system, and then we'll be able to partner with the system. Next. So thank you. This is what I have. As part of our experience, we think working with the private sector, I think really has to have a framework that is very transparent, a framework that is very open, but most of all, we have to build up confidence. We have to have a system that everybody will be glad to join, everybody will be happy to be part of. And like Azuka said, the PPP, pay us, patronize us, and I think the other one is partner with us. I can't remember myself exactly, but I think it is very, very pertinent. But also on the government side, we need to also be confident of the private sector. I think we need to build that relationship. The mutual suspicion should actually be banished. That is the only way we can progress working as public and private sector. So for us, our experience is that if we put aside these notions, then we'll be able to work together and we'll be able to achieve our dreams together. So thank you very much for listening, and I hope we have a good meeting.
Thank you very much, sir. Thank you so much to the ES for his presentation. I will just speak a little bit more on the partnership that he mentioned, just from the, in terms of, on a broader sense, as to the key insights from the PPP. Joseph, can you just help project the slide? Thank you. Thank you. And so, so this basically just highlights or gives a bit more information as to the public-private partnership that the Executive Secretary has mentioned. And so what's currently going on in Yobe State is that ARC has been able to support the state to sign a memorandum of understanding with the companies shown in the slide. So Fitton, Drugfield, Juhel, Mayer Becker, SKG, and Philips Pharmaceutical, who is a local distributor. And the key points to note about the PPP are that the availability of quality and affordable medicines. I think the ES highlighted that extensively during his presentation on the importance of having quality and affordable medicines. And so one of the key terms or clauses in the memorandum was around the private sector selling the products at distributor price, which I think the ES also highlighted in his presentation. The second clause is around the exclusivity clause, in which a clause was included in the contract, which states that the state will procure from these local pharmaceutical companies for a duration of 2 years, and will basically buy exclusively from the list of companies that are highlighted on the screen for the products that have been agreed on. And the last one, which I think is an important point to note, is that the Yobe State government has actually been very forthcoming in terms of meeting the payment timelines that were agreed on in the memorandum of understanding. And so, like the ES said, the PPP was quite, well, I say it was we had to get everyone to come to the table with an relatively open mind, understanding that it's, like he said, a marriage. And so there was quite a number of back and forth in terms of negotiations as to terms of, for example, lead times for the pharma companies, payment timelines for the government. And so once everyone was in alignment and everyone agreed to the terms, we went ahead with implementing the PPP. And like he said, there's been quite a lot of progress that has been made. both in the state, and the pharma companies will attest to having received payments for multiple suppliers at this stage, not just one supply, but multiple suppliers. They've also just recently completed a quantification exercise, and so there should be subsequent supply requests sent to the companies again. And so I just wanted to highlight that those points, just so we put some context into what the PPP currently looks like between the state and the pharma companies. Thank you, Joseph. So we'll then move on to the next item on the agenda, which is the panel session. But before we do that, I would just like to provide some context on how exactly ARC is able to broker these partnerships, and just to speak a little bit of my role. And so, like it was previously mentioned, I'm the Program Manager, Private Sector Partnerships for Africa Resource Center for Excellence in Supply Chain Management. And my role is to manage all relationships with the private sector, as well as manage our what we call a corporate membership platform. And our corporate membership platform is basically a platform which we use to engage both local and international private sector companies who are interested in supporting the government to address public health supply chain challenges. And so the platform provides us with an opportunity to be able to engage these companies in a coordinated manner. And when we say support to the government, that entails both what we call corporate social responsibility support. So where you are supporting maybe potentially with capacity building or along those lines without necessarily any financial benefit to the company. We also have opportunities like the PPP that we discussed, where the farmer is actually providing a service to the state and is being paid for that service. And we also have the option of doing both, where you provide a service to the state, or you also support with a through your CSR. And so we currently have 71 members in our platform currently, and that's both local and international companies from various sectors, including pharmaceutical companies and pharmaceutical sector. And so the companies listed mentioned in the PPP are all members of our platform. Logistics, FMCG, and products manufacturers. So companies that manufacture cold chain equipment. And so to move on to the panel session now, I will now ask that the other panelists please introduce themselves. We will have Mrs. Azukaego, whose profile is being projected now. Please introduce herself, and then we will call on the other panelists to introduce themselves. Thank you. So, Ms. Azuka.
Hello, everyone.
Hello, everyone.
Ladies and gentlemen.
Ladies and gentlemen.
Good afternoon.
Good afternoon.
I will stand on existing protocol. Please allow me. It's a pleasure to be in this forum today and to really listen to the exciting conversations that have been ongoing so far. It's really exciting to see the length of collaboration already ongoing. For me especially, I'm the supply chain director for Kimberly-Clark. I am responsible for supply chain end-to-end, strategy, decision-making, and operations in Nigeria. Kimberly-Clark is an American company focused on doing business in Nigeria, and we're in 175 countries. I'm very much excited because I belong to a network of supply chain professionals where we all sit in a group, and we always speak about expertise sitting in the private sector and needing to come out beyond our area or our space. I have spent 10 years of my career in supply chain and under 10 years in sales and commercial. So basically in the commercial environment. I am really happy to be here. I am a Nigerian residing in Lagos, living in Lagos. And I look forward to engagements and conversations like this. Thank you.
Thank you, Ms. Azuka. Ms. Margaret, would you like to, I know the people in the session probably do know you already, but please just a brief introduction. Thank you.
Thank you very much. This for me is a very, very important session. I'm calling from a place where it's still very much morning, but it is a session that I believe that most of our companies should really tap into. There is a growing interest in the public and private sector partnerships, and in supply chain, this is even more critical, especially as we know what has been in the space, what happened to us last year. Supply chain has become even more critical. So this for me is a great session, and I look forward to us sharing more thoughts about what we're going to be discussing. Thank you.
Thank you, Ma. So our last panelist is actually the Executive Secretary of the Yobe State Drug Management Agency. Sir, if you would like to just briefly introduce yourself. Thank you.
Thank you very much. Like I said, I am Azukaego Mohammed, the Executive Secretary, Yobe State Drugs and Medical Consumables Management Agency. And for us, really, in UEDMA, what we pride ourselves in is that we like being the guinea pigs. We like being out there. We like testing the waters. We like challenging the existing norms. And that is why we're doing what we're doing. We have DMS in Nigeria that are over 15 years old, and they have not actually stepped forward. And we felt that it is time that somebody steps forward. What we believe is that even within the government cycles, we even if we don't have the expertise, we still have the capacity to be able to have supply chain systems that will be responsive to the demands and the desires of the public sector. And that is why we think that working with the private sector, getting the lessons learned from the private sector would help to improve what the public sector is. And then at the end of the day, that would also help to improve the outcomes in the health sector, especially on the public side. And so for us, we are happy to be here. And we think this is going to be also another eye-opener for us. Thanks to ARC for convening such meetings. And we are open to all suggestions that would help us to progress our agency to the next level. So we're happy to be here, and we hope we have a fruitful discussion. Thank you.
Thank you. Thank you very much, sir. And so, like the topic of the panel session states, the focus for this half of the session, or this panel session, is on how do we begin to now get the global private sector companies to participate or to engage with the public sector. I believe the previous sessions have spoken extensively about how some of the local private sector have been engaging with the public sector. But now we will speak a bit more on how the global companies can start to engage. And so we'll start off with Ms. Azuka. Ms. Azuka, how, in your opinion, do you think the global private sector can begin to get involved?
Okay, thank you very much, Stephanie. Am I audible enough? Can you hear me?
Yeah, we can hear you.
Okay, awesome. As we all know, Africa's private sector accounts for about 4/5 of its total production and about 2/3 of its total investment, and also employs about 90% of its working age population. What this means is that there's a very established private sector, but more importantly, a good number of the private sector organizations have foreign or parent bodies. Take, for instance, my organization, where in about 140 countries or over, we've been in operation for over 170 years. And we, I think, came to Nigeria about 8 to 10 years ago. Before this place, I was in Mondelez. Again, Mondelez, what we know as Cadbury, is in a number of countries across the world. I think that it's important to have strategic forums where we have an open or inviting hand as the government and government agencies to the private sector, not just extending to those in the country, but actually spelling out the areas of collaboration that is possible. I sit in this conversation today and I hear the possibilities. I will take it back to my office. And beyond that, I will also inform to say there's a huge area of opportunity to engage in this area, to support these initiatives. How much of these conversations do we need to have? I will say that conversations within the private sector, you'll be amazed to hear that we don't even have the easy access to engage with government. I remember when we had some challenges in Kimberly-Clark, we reached out to the American Business Council. We also reached out to the African Resource Center. So there needs to be a deliberate invitation as is happening now. These discussions have to happen so that we bring both sides to the table on a much larger scale and more often. That for me is a very fundamental way to enable this.
Thank you. Thank you very much for your response. And I think that touches a little bit as well on the next question around the challenges. So thank you very much for that. Ms. Margaret, we'd like to hear your thoughts on this question.
Thanks a lot. I hope you can hear me.
Yes,
Yeah, we can hear you.
So increasingly, because I will speak especially to in relationship to US companies. We do have, she mentioned Cadbury, but we do have a number of US companies that will benefit from these engagements with public sector, with government in supply chain. And I'm happy that a number of them, are on this call. I come from a past life of a pharmaceutical company where running with public affairs, you're looking at how you can engage government to improve eventually not just relationships but also to help increase the business, and working in this manner and being able to engage projects like this are really, really critical. And like I said earlier, even more critical at this point, because then you're able to put in to ensure that you bucket in all the contracts. We used to say then in that organization that we have value beyond the pill, and so this is where companies are able to not only do good and clean business, they're also able to have the 360 overall value beyond the medicines that they would supply. So for me, I see a situation where being able to engage governments, being able to work closely in a manner like this can really help both the private sector and the public sector drive better outcomes. And more importantly, it would help clean up what I always say, the supply chain pathway. So issues around counterfeits that are usually the bane of the challenges we see in the country could really be mitigated, through these kinds of engagements and partnerships. I'll stop there at this point. because I'm sure you have a lot of other questions to ask us.
Thank you, Ma. So the ESA.
Okay, thank you very much for that question. I think opportunities abound where we can come together as a public and private sector. I think there's a wind of change, even though it may not seem like that in the country right now. But when you are from the government side, you begin to see that, yes, something is happening and governments are beginning to realize that they can't go it alone. There has to be some kind of support from the private sector. And I think this is the moment to seize the opportunity. Why do I say that? Resources are becoming more scarce. Governments are struggling to be able to meet up with their constitutional obligations, and any opportunity that arises that would help them in terms of keeping up to their campaign promises, keeping up to what governments stand for. I think these are the opportunities that governments are looking at. I'll just give a brief example. We are in Yodma now. We have mobilized resources, and those resources are what government would normally put up to be able to procure drugs, medical consumables, equipment to send to the health facilities. And now we are able to mobilize those resources. That burden has been taken off from the government. And those are I think the tangibles that government wants to see is when there's an investment and then it is yielding results. And we are starting locally, yes, I agree. But I think we need to start local and then see how we can expand and then go global. So like what you people say all the time, we have to be local, right? We have to think locally, but act globally. And for me, that is, I think, where we need to start looking at it. For us, we started from Yobe, but we're engaging with other states and we're engaging with the Governors Forum. And if that is happening, we brought in the PMG man in the Governors Forum thing. And then we think that beyond that, ARC is there. We could also start looking at how we can interact with the international community. So, okay, these are the opportunities that abound. Maybe catalog this kind of things. Some organization like ARC can do that. Look at all the opportunities that abound and point to the international community or international businesses to say, okay, these are opportunities that abound in Nigeria, and you'll be able to discuss, even if it is on a bilateral basis with the governments. And then on the government side, we'll be able to see how we can put enabling environments for these companies to thrive. I think those are, some of the things that we need to do. Engage at all levels of governance and see how we can push the agenda forward. But then also we need to also put the word of caution there. Various states are in various stages of implementation. And so we need it has to be a gradual process. Like I said previously, there's a lot of mutual suspicion, both on the part of government and the private sector. But I think when we bring down these walls, we'll be able to see clearly the opportunities that abound. Everybody will realize the benefit that can accrue to both parties at the end of the day. And I think that is the surest way to go. Give us what it would look like when you come in. And then we'll be able to say, okay, this is what our dream is going to be. And then we'll be able to work together to achieve those dreams.
Thank you very much, sir. I think that was very detailed response, I believe. We touched on I mentioned earlier that Mr. Azuka actually touched on the next question previously, and I just wanted, Ms. Margaret or Mr. Azuka, either we can respond to this. But are there any other challenges that you see that the global private sector is having in terms of engaging with the government? I mean, it may not. I mean, there's obviously the government, making themselves, giving access to them to even be able to begin to have these conversations. But then, are there any other sort of barriers that that you foresee or that exist?
Yeah, thanks a lot, Stephanie. I think one of the major barriers I see is the mindset. Again, is a mindset that it is difficult to work with government. So, for instance, again, borrowing from a past experience, I do recall that when we wanted to, run into tender opportunities with some of the states in Nigeria, most of my colleagues then told me, "Oh no, as a U.S. Corporate entity, we're not able to do that because it's usually difficult to work with government. You're going to have issues on payments. You're going to have issues on things that have to do with governance, and that may become a major challenge when it comes to issues around the FCPA, and so that is a mindset that has to change, and this project, with Yobe, is a typical example of how things can work. So, like I see on this call, we don't have a lot of people, but we have a lot of quality members of the council, who are very much impacted, or who will be very much impacted by this, this discussion we are having today. So, and to the point of the executive secretary, for me, this is just the first stepping stone. We can, really take this beyond this conversation here to a larger group, and working with ARC, and the executive secretary engage with the governors forum on the opportunities that abound in Nigeria, to show that these things are workable. So these are just some of my quick thoughts on this.
Thank you, Ma. Thank you very much. I think what you had mentioned, mindset, is similar to what the ES had mentioned as well, with the challenges at the start of the PPP. The mindset and people just believing that it can't work, because genuinely, based on past experience, some people have had not so pleasant experiences in the past with the government. But like you said, we need to move forward. We need to look out for the new opportunities, and like you said as well, the government is open, or is relatively more open now to these opportunities than maybe they were in the past. Thank you very much. Unfortunately, we can't take any more questions for the panelists, but we will open it up to the audience to see if anyone has any questions for the panelists before we end the session. We seem to have really gotten into the conversation and almost run out of time. So thank you very much to the panelists. So if anyone among the participants has a question, please either raise your hand, or you can type it in the chat box and we can quickly take the questions. Thank you. Joseph, so apologies, can you help check? I'm not sure how it works with the hand raising. Are there any
No
hands
questions.
Okay.
No questions.
So I think, okay, we'll just take the last question. In terms of, are there any opportunities currently available? Yobe State has, I think, made a massive pitch here today on the opportunities in Yobe State, but so this is open to any of the panelists. Are there any other opportunities that you see that you think the other people on the call could potentially start to engage with?
Yeah, so maybe one or two things, I think. First of all, I think we need to have, just like we had with ARC and the Farmer Group, I think when we have a broker in the middle, it helps to at least bring the parties together, just like we are doing now. And so this is one opportunity. I think the ARC Center of Excellence thing and everything, I think that is a huge opportunity that we need to tap into. Bringing businesses together, linking government with businesses, linking government with the private sector. I think that initiative is one of the opportunities that we need to. The second opportunity, I think, is also working through the DMS or through ARC, also working through the Governors Forum or the DMS, looking at how they can individualize packages for each state. What I know is that for us in Yobe, we are trying to see in the next 4-8 years what we can do with, especially health tourism in the country. And that is what the mantra has been, from the executive governor to the honorable commissioner to all the heads of the agencies under the ministry, and also beyond the Ministry of Commerce. Everybody is on board now. So for us, we are looking at those opportunities where we would have a system that would be responsive to the needs of the country. And I think those are the things that we need to start itemizing. Like I said, documentation. Some organization like RC can do that. Go to each state, look at what the peculiarities are, look at what the government really is doing about the health sector or any other sector for that matter that is going to be economic and then also going to impact on the people, and then document that and then put it out there for the business community to be able to look at. I think those are opportunities that we can actually use, especially now that we have a lot of people going back to the States that have actually had work experiences outside and are going back into government to see how they can influence things. So these are opportunities that we can actually leverage on to move forward. Thank you.
Thank you very much, sir. So I believe we have a hand raised from participants from Johnson & Johnson. If you'd like to go ahead and ask a question, thank you.
Thank you very much, Stephanie, and thank you very much to the panelists. I think some of the questions I wanted to ask, the ES has spoken to them, and I see that the program as a whole is quite comprehensive in taking care of some of the derailers that have made us as a multinational to run away from such partnerships. So listening to what has been said today, I think there's a lot of encouragement. So my question would be that to the ES or Stephanie would be that is Yobe State, are they still open to collaboration, looking at the fact that they have an existing template already that they have done? If yes, then we'll look at how can such conversation be taken to the next level, because overall, that's the reason why, such platform is created for us to see how we can leverage on it. So that would be my question to either the ES or to Stephanie, that is from ARC. Thank you. Thank you.
Thank you very much. I think I'll let the ES respond. I believe they are, but I want him to respond. Thank you.
Okay, thank you, Stephanie. Yeah, I think opportunities abound all the time. When we started, we were very mindful of the fact that the companies that were going to engage, there were 3 initially, would not be able to provide everything that we needed. So as we moved along, we had to discuss and say, okay, these are the terms of the rules of engagement, so to speak, in our MOU. So products that are manufactured by these companies, we are bound by the MOU to patronize the companies. Products that are outside the purview of these companies, then we can go out and source. And after a few months, we realized that that is not really working because most of the products were outside the purview of these companies. And so the additional 3 companies, that is SKG and M&B and Netflix pharmaceuticals. But then you will agree with me, when you have like 400 items on your menu, it will be very difficult for just 6 companies to actually, especially if these companies are only into drugs and drug products. Consumables are there. We have all the other detergents, cleaning materials. We have laboratory reagents and all of that. So these are also a huge chunk of what we are doing. So areas of collaboration are still available. And we are currently we are discussing with some importers on how to get some other consumables like syringes and needles and all of that, so that we'll be able to complement what the pharma group is doing. So it is a huge opportunity out there, really. So we are open to collaborations. And like Stephanie said, they are limitless, I think.
Thank you. Thank you very much, sir. I actually wanted you to be the one to highlight that point, that there's still a bit of a gap in terms of what the farmer is providing and what the state requires. Thank you very much, everyone. So I noticed that there are no other questions. So thank you so much again to the panelists.
Hi, Stephanie.
Hi, Stephanie. Yes, ma'am. Yes,
sorry, I just wanted to make a comment here. And one of the things I would like, because I always like for us to have interesting takeaways, is that if we can really start, in partnership with ARC and, the Yobe State government to kind of post on, our platforms, especially our website, the existing either tenders or things like that, so that even U.S. companies, because we're talking about health tourism, investment opportunities, so people who are outside and are various partners, in the U.S. are able to see that sort of opportunities exist, and where, for instance, our companies already existing in Nigeria are not able to tap into those opportunities, then that could even be one way to expand, the growth and even investment opportunities, and also meet obviously the needs of the Yobe State government. So for me, I think that could be a great takeaway if we're able to post through some online link or platform of existing tenders and things like that. It could be a great takeaway from this meeting.
I don't know if I could respond to that. This is Azuka.
Yes, Azuka, you can.
Okay, thank you very much.
Minute.
Thank you very much. All right, thank you. So I think the next step from our own end is this collaboration. Like you heard Abdulaziz mention that is a kind of a marriage. So it's not necessarily sharing open tenders or giving information to companies externally like that. There is a partnership model that has been developed that enables appropriate negotiations. So I think one of the things we can do as a takeaway is to look at how members of ABC be members of ARC, because it's from there that we can share opportunities and begin to frame partnerships. So maybe that's another takeaway. How do we get more members of ABC who are interested in this kind of business, being members of ARC, and have access to these opportunities? And then ARC can play the role of brokering the partnership. So sorry, Stephanie, I know you said 1 minute. Next week, we are in Abuja. Yobe State Commissioner for Health is hosting about, I think, 10 commissioners for health and the CEOs of companies. And they will be talking about expanding this model to several other states. Like Abdulaziz mentioned, it will go beyond Yobe State. So there is enough for everyone. But what we want to be sure is that the collaborations are well structured so that we are PPP from private sector is met. So thank you very much.
Stephanie, if you allow me, please. I just want to add to what Margaret and Azuka has said. The private sector looks for ways to collaborate with government. So for us, the key thing is visibility. If we have sessions with other American business companies to start the conversations, if we're able to, if there's more visibility to what is currently going on, I think it would be very helpful. And that's the point Margaret made about the website. That's the point Azuka made about other members of ABC being also members of ARC. Because for us, that's critical. We have to be able to show that this is what is happening to our parent bodies. This is what is happening. This is how we can partner. And the fact that it's currently ongoing. Another area I wanted to touch on is the fact that there was the conversation around state-specific programs. It would also be nice to have industry-specific programs. So for instance, it would amaze you that a company like ours, Kimberly-Clark, who is focused on feminine and baby care in Nigeria, actually produce PPEs in other parts of the world. So this kind of visibility on what exactly are the opportunities in terms of what is required, what is currently happening, what are the other areas that are open, will help one know the extent of engagement that is possible. So basically for me, visibility, extent of engagement, and because I know that a lot of the multinationals, what they do in Nigeria is not the entire coverage or the entire portfolio they carry. So for me, those are the two critical areas. Thank you very much.
Thank you. Thank you very much. I think your comments summed up quite well, both responses from Margaret and Azuka. Thank you. So On that note, I think we will end the session. We will just call on Zainab from Kimberly-Clark to give the closing remarks. Thank you, everyone. Thank you once again to ABC for the opportunity.
Hi, everyone. Can you hear me?
Yes, we can.
Okay, fantastic. The importance of a strong supply chain cannot be overemphasized. If anything, last year taught us that we have to pay more attention to this, and it shed a lot of light on this. This model in Yobe states shows what happens when the private sector and the public and the government rather collaborate on life-changing policies, because we're actually making a difference, because it shows the government cannot even do it on its own, and the government does need the private sector. So that's where organizations like the American Business Council, like ARC, come into play. I think if there's anything we would want to charge companies with today is to see how we can help bridge the gap and work better with government so that we can make a difference in the various states that we're operating in Nigeria. And I'm sure this is something the council will take on board and will explore further. So on behalf of the American Business Council, we would like to thank all the panelists for coming today. Thank you for sparing your time. I know we were overrun, but it was a fantastic session. Thank you very much.
Thank you, Zainab. Thank you, everyone. Bye-bye.